Good morning, and welcome to Healthcare Day. I'm Kari Griffith, VP of Sales for Healthcare here at Phenom. Around here, we have a clear mission. That mission is helping 1 billion people find the right work. In healthcare, that purpose takes on special meaning. When we help you find the right nurse, the right technician, the right caregiver, we know you're not just filling positions. You are ensuring patients receive the care they deserve from professionals who have both the clinical expertise and the compassion to heal. We do this by focusing on your specific challenges and how hiring and development needs play out in all areas of the healthcare industry, from hospitals to long-term care facilities and clinical health systems that could span throughout the globe. Let's talk about what's happening in healthcare right now and your unique challenges. Healthcare organizations are experiencing unprecedented staffing crises right now. We are seeing consolidation through mergers and acquisitions, creating large integrated delivery networks. Technology is reshaping how care is delivered, from telehealth to AI-assisted diagnostics. As well, patient expectations have evolved dramatically. Patients want convenient access to personalized care and ultimately a seamless experience, just like they receive from any other consumer brand. Meanwhile, an aging population is driving demand for services, while the workforce itself is aging out. The shift toward value-based care means organizations must deliver better outcomes with fewer resources. Home health and behavioral health services are exploding with demand. And through all of this change, one thing remains constant. Healthcare is a human business that requires skilled, compassionate professionals at every level. These industry shifts are creating a perfect storm of talent challenges. First, there's the sheer magnitude of the shortage of talent. Nearly 50% of hospitals report clinical staffing shortages as their number one operational concern, with average vacancy rates of nearly 20+% for registered nurses and medical assistants. Not to mention the over 25% vacancy rate for CNAs in elder care. In the U.S., specifically healthcare organizations are projected to face a shortage of up to 86,000 physicians by the year 2036. But it's not just about vacancy statistics. The real impact is on daily operations and patient care. Hospital turnover reached 22.7% in the year 2024, causing the financial implications to be staggering, as turnover costs reach up to 200% of an average employee's salary for specialized roles. Every unfilled position does not just cost money. It impacts patient care, increases wait times, and puts additional strain on your existing staff. The competition for this talent has intensified beyond anything we have ever seen before. You're not just competing with other health systems, you're also competing with traveling nursing agencies that are offering rates double or triple your staffing budgets, compounding these challenges of vacant roles and a declining workforce. Speed has become critical. When a qualified nurse applies to your organization, they are likely applying to 5 other roles simultaneously. If you do not engage with them within 24 to 48 hours, they are most likely gone to one of your competitors. But here's the real challenge. You can never sacrifice quality for speed, especially in healthcare. Healthcare hiring requires credential verification, background checks, licensure validation, and often multiple interviews. A frictionless candidate experience has become a differentiator that leading healthcare organizations are leaning on to get the best talent through their doors to care for their patients. Meanwhile, today's healthcare professionals, especially the younger ones entering the field, expect mobile-first applications, instant communication, transparency throughout the process. They are comparing your hiring experience to their last Amazon purchase or Uber ride, not to other hospitals. This is where technology makes all the difference. Modern AI-powered platforms are specifically designed to address the unique challenges of healthcare talent acquisition and retention. These solutions help organizations attract the right candidates, engage them instantly, and move them through the hiring process at the speed in which they expect, all while maintaining the quality and compliance standards that healthcare demands. Now, I know some of you might be thinking, AI in healthcare hiring? What about the human touch? Let me be perfectly clear. Our goal is not to replace human judgment with algorithms. It is about enhancing human capabilities with our intelligent tools. Our AI is trained specifically on healthcare data, understanding the nuances between different clinical settings, specialties, and credentials. But every decision point includes human oversight. We automate the repetitive tasks, those soul-sucking tasks like scanning resumes and scheduling interviews, sending reminders, so your team can focus on what humans do best: assessing cultural fit, evaluating soft skills, and building relationships. Our platform includes bias detection, explainable decisions, and full audit trails. We help you maintain compliance with emerging AI regulations while leveraging technology to solve your talent challenges. Between all the current challenges you're facing, the staffing shortages, the aging talent, the speed versus quality balancing act, people are still in need of care every single day. Patients still depend on you to be there when they need you most. Families are still trusting you with the people who are most important to them. Meanwhile, that mission, that calling to heal and care for others, does not stop. What's also true is that AI and technology are advancing so rapidly, it's hard to keep up with how they might transform not just patient care, but also how do you attract, engage, and retain the people who deliver that care. So today, the question is no longer whether technology will reshape healthcare talent acquisition. It is how you will lead the transformation. But here's the great news. Over the next 90 minutes, you will see exactly how healthcare organizations are transforming their talent strategies. You will hear from healthcare leaders who have been in your shoes facing the same shortages, the same budget pressures, the same compliance requirements. You will discover how to automate high-volume roles without losing that human touch, build talent pipelines for hard-to-fill clinical roles, and create internal mobility programs that combat burnout and loss of your talented staff. Most importantly, you will leave with clear next steps to take for your own transformation. Because at the end of the day, this is not about technology. It's about ensuring every patient receives care from qualified, compassionate professionals. It is about giving your clinical teams the support they need. It's about building a sustainable healthcare workforce for the future, for all our futures. Thank you. Let's get started and jump into the day.
Welcome everybody to Healthcare Day, a part of Industry Week. We are so excited to be here today because we have a really special segment for you today. We are here with none other than Amy Donssky from CHOP, and we're going to be diving into their unique story about how they're starting to apply AI and automation to really support all the great work that they're doing here at CHOP. Thank you so much for being with us today. And as we get going, I'd love to really understand a little bit more, like what brought you into CHOP? How did you get started with recruiting, let alone within healthcare?
Yeah, so I've been at CHOP for 15 years, which seems like both, a blink of an eye and forever, depending on the day. My mom actually worked at CHOP for about 25 years as first a nurse and then a nursing leader. So I grew up, hearing that always and thinking like, wow, that sounds like a really great place to work. I had the opportunity when I was in college to do a couple of different things during the summer with some nursing offices, and then also some research studies. And again, just really loved the culture and said, I want to figure out how I can work there when I graduate. I did a senior project with the Nursing and Respiratory Career Center, as it was called at the time, and really just fell in love with the idea of being able to help bring people into this great organization and help them discover what is so wonderful about it, and really bring in amazing talent. And luckily, they had an opportunity for me when I graduated, and kind of started my journey in the talent acquisition space. And over the years, we grew from, it was I think 10-person team in nursing recruitment specifically, to now we're close to 50, probably over 50 in all of talent acquisition at CHOP. I stayed in that nursing space for a while and got involved in more of the technology as that started to develop, and we started to implement different applicant tracking systems and things like that. It kind of sparked my interest, and then moved into an operations role about 6 years ago, and I'm now the director of talent acquisition operations.
That's amazing. Talk about a childhood like dream and aspiration, and connecting those dots. And I shared this with you before, like one of my first introductions to what makes the city of Philadelphia so special was before I even heard about, all the great work that the other medical institutions within this city were doing. I first heard about CHOP. It was from my friends who their children were greatly served and like provided amazing care, from crazy experiences all the way back to just living full, abundant, beautiful lives.
Yes.
And so like, this is just awesome to get to be here. You started to tap into a little bit about the reach of your organization, the size of your recruiting team. Maybe can you set the table for us a little bit about CHOP's overall reach? How many patients are you guys seeing each year? How many folks are coming through your doors, and how does that impact the way that you guys staff?
Yeah, so I mean, we have about 1.6 million outpatient visits yearly and 35,000 inpatient visits. And so, as you can imagine, that reaches, every corner of the globe. We see patients locally, but then we also see patients coming from quite literally all over the world to receive the best-in-class care here. And we treat things that other institutions just can't. So when we think about the type of person that we need to hire, and making sure that we have the best people to provide the best care for those patients and families, it's a critical role that the talent acquisition organization plays in the overall mission of CHOP.
Without a doubt, because if you're not getting the people in here, you can't provide that world-class care that you've been able to provide for over 170 years at this point. I mean, that's a really long pedigree. So can you tell me a little bit about like those roles, right? It takes a community in order to provide exceptional health care. It's not just the doctors, it's not just the nurses. Could you tell us a little bit more about some of the complexity of the roles that you do have to staff for to keep this building up and running?
Yeah. I mean, as you mentioned, Mike, like, of course, the doctors and nurses play an integral role in our patient care. There's even more interdisciplinary team members from the clinical aspect, like social workers, like child life specialists who are helping patients and families cope with different diagnoses or surgeries, or preparing for procedures or all sorts of different things. Psychologists, PT, OT, all different clinical disciplines. But then you also have everything that's happening almost kind of behind the scenes.
Right.
Anything from our IT staff, right? Like, we need to make sure that all of our systems are working.
Secure,
we need to
compliant.
Yes, absolutely. If something's wrong, if a nurse can't get into the patient chart or whatever might be happening, they need to be able to call someone and get that fixed. So there's those types of roles. There's finance, right? We need to make sure that our revenue cycle is
gotta keep the lights on.
We're like getting the bills paid and getting reimbursed from insurance and all of that. Roles like human resources, where we're helping to support the people that do all of this, and things like environmental services, where if the room is not clean, if we don't have the resources that we need from a facilities perspective, then we can't take care of patients and their families either. And one of the key things, we've been blessed to always have a really strong brand, and we have a really strong brand because we do amazing work. That has always been the case in the clinical space in particular, and people knowing, that they want to come work at CHOP as a nurse, as a doctor, because of how what we do to take care of our patients and families, and the innovative procedures that are happening here and those sorts of things. But then as we started to look at our overall employer brand, some of the things that we started to ask were, okay, so why would someone who works in IT or someone who wants to work in environmental services come here and want to work at CHOP and not go work for any other company in the area, or sometimes even in the country if it's, a remote role or something like that?
Yeah. Was there a pivotal moment when you realized, like a watershed moment when you realized that things had to change?
Yeah, I mean, the pandemic, of course, everyone's favorite, unprecedented times, right? So much changed then, and really opened up a lot. And honestly, we were doing things and working in ways that we hadn't before at CHOP, which was really amazing to see. Even things like, we had the contact tracing center was our was the Philadelphia area COVID hotline. And that really spun up out of nothing. It was our poison control center team originally.
Oh my gosh.
And then in a space of months, probably weeks, we were suddenly taking all of these calls for the greater Philadelphia area and, trying to triage and walk through folks that were very distressed and very highly escalated, because obviously there were a lot of unknowns, and trying to talk them through. And we needed many more staff to be able to do that. So looking at how we could move folks around internally and make that happen was one of the key things that came out of the pandemic. And then when we started to do things like that, we said, there's a lot that doesn't have to just be for this time of crisis during the pandemic that we can carry forward. And at the same time, obviously, the clinical space was really hectic during that time and very tough to be in. There was a lot of burnout, not just here, but across the nation, for doctors, for nurses, for that clinical staff. And suddenly folks started going, is this what I want to do? I don't know. So we certainly saw, some folks take a step back during that time. And we did really see that as a moment to also take a step back and say, okay, well, what is it that should make people want to work here? Whether that's in patient care, whether that's, in another part of the organization. How can we tell that story? How can we help those professionals out there, regardless of what their discipline is, see a place for themselves at CHOP? Yeah,
without a doubt. And so could you paint a little picture for us? I really appreciated the story just around the call center, needing to spin that up. And you were also using technology to spin that up, right? As far as to be able to handle the volume of calls, the amount of people that were coming in, all of that stuff to sort it out and get it there. Looking back at that moment, what was your recruiting strategy like before the pandemic? What were the tools in your toolkit? So again, thinking back to that moment where you had to scale up quickly.
Yes.
What did you have going on?
Yeah, and so one of the things that became very apparent that we didn't have a great grasp on, to be completely candid, was that idea of being able to proactively source and proactively kind of know, okay, these are the candidate pools that we're working with externally. We had an applicant tracking system. We had some ability to do some talent pools and things like that in there, and send messages out, but very, very limited in terms of automation. Certainly AI was just starting to, it's wild to say that this was only 5 years ago, right? But
oh my gosh. Yeah.
5 years ago, AI was just really starting to come out.
It was an idea.
And it wasn't super prevalent yet. So obviously we didn't have any AI capabilities around our recruitment technology. And it did kind of make that apparent that we needed something to be able to scale and scale quickly, because that's an important piece of it too. We want to build, repeatable, reliable processes, but they have to be able to scale, because we're going to continue to grow as an organization, and we can't always say, okay, then let's hire 5 more recruiters. Like, that's just not realistic.
Right, because then you have to go find them.
Exactly. And how do we find them if we don't have the technology to help us do it?
Exactly. And so when you guys were starting to go explore this journey of building out a system of engagement for CHOP, I mean, you guys could have gone multiple places. You could have found somebody that could have provided you with really great hiring, interview intelligence, somebody that could have built you out a career site, maybe somebody that could have given you a chatbot to talk to candidates. When evaluating, what were the things that were important to you from a vendor, and what were some of those things that stood out on that journey?
Yeah, that's a great question. So some of it was, again, what is that technology that's going to allow us to be able to scale quickly? So automation, now even more so, has become a huge strategic imperative for us as an organization. But even 5 years ago, we were thinking like, how do we essentially do more with less, right? So the automation piece was critical. The usability of the system was critical, right? Our recruiters, our sourcing team are going to be in there trying to find candidates. Like, it needs to be easy for them. It can't be something where they have to remember, oh, well, I click here, here, and here, and then that brings me to here, but then I have to go over here. Like, no, it needs to be intuitive. The career site was huge for us, because our legacy career site really didn't have a lot of flexibility when it came to updates and even design. So we didn't have a lot of leeway to, even some of our branding guidelines. Like, we didn't have the right font necessarily all of the time because it didn't support it. But beyond that, just making an experience for candidates on the career site so that they're feeling like the content that is out there is applicable to them.
Yeah.
And being able to serve that up to candidates how they're consuming it, right?
Of course.
And not having to over-engineer it so that on the back end that we have to engineer all of that, but a system that's smart enough to be able to do some of that. And you mentioned the chatbot. That was a huge piece too, looking into like, okay, so how can we have something that feels like it can be interactive for candidates, but it doesn't have to be an actual human sitting there and answering questions, because that's not realistic either.
Totally. Yeah. So we kind of started keying in on like point solutions, right? There's a lot of different options on there. How important was it for you to have a vendor who could actually grow and provide you with all the tools that you would need in your toolkit?
I mean, that's really critical for us in general, because again, I've been at CHOP for 15 years. I think when I started, we were at like 10,000, maybe 11,000 employees. We're at like 30,000 now.
Oh my gosh.
And continually growing.
Yeah.
We have several new buildings that are opening up in the next couple of years. So again, growth is kind of always on the horizon for us. And yeah, we're always looking to make sure that the systems we're investing in can kind of grow with us and be able to provide us that flexibility as we need it.
And looking in at that importance of like keeping your data synced up, could you tell us like a little bit about like what did life look like? Like
Yes.
a little bit before and after, kind of bringing everything into something
that's a great
centralized.
Question. And that's always been critical to making sure that our ATS was synced up with our core HR system, synced up with whatever other components we were having going on there. So one of the things that we were looking for when we were looking for a candidate engagement solution was making sure that it would sync up with our ATS, provide those real-time updates, right? We don't want to be like reaching out to someone if they've accepted an offer with us already. That looks like we don't know what we're doing.
Totally. I think that like having a bi-directional hiring status integration between ATS and other points, especially a system of engagement, that's one of the most foundational things to put into place in order for you to really build out some of those automations, some of that AI functionality to really let you take full advantage of a system of engagement.
Yeah, and that's a great point too. It allows us to be able to build automations off of those things.
Yeah.
So like, I was actually just chatting with our sourcing manager this morning about looking at, okay, so we want to look at candidates who have withdrawn from the process at interview stage and building out an automation for certain disposition codes, you know, if they withdrew because they were unresponsive or the location or whatever it might be, we want to see if maybe now's a better time. And can we build out an automation to be able to reach out to them and say, hey, we're still hiring. Here's what you did with us before. Are you still interested? Here's some action steps to take if you are.
Right.
So yeah, being able to kind of know where that candidate's journey ended in the ATS has been critical for us too. That's just one small example of like a bunch of different things that we have set up or are looking into setting up.
Without a doubt, with hiring automations, I think what so many folks often overlook as far as one of the main value drivers for that is being able to start spotting those bottlenecks, right?
Yep.
Seeing where people drop off, especially in key parts of your hiring process, and you're able then to segment them out, like, do they just not respond? Do they apply for a different job? And then you could start to tailor that message specifically to them. How are y'all using AI and personalization to really kind of build up those campaigns quickly?
Yeah, there's a couple of different ways. Certainly, you know, the ability to use AI to at least start messaging for us has been wonderful, because then you're not sitting there going like, all right, I know what I want to say, but like, how do I put these words together? So that's been very helpful, especially for kind of like ad hoc outreach. We tend to have, you know, more templated messages when we're doing larger campaigns and that kind of thing. But we love the idea of being able to get that jump start.
Oh my gosh, yeah.
And being able to surface candidates who match a job description has been something that we've been looking at a lot. Being able to kind of like train the AI, because I'm sure that other organizations can identify with this. Our job descriptions tend to be like a little bit long. We want to put all of the things in there. We need to, you know, must be proficient in
AI
Microsoft
is a great
Word.
editor, right? Like it can quickly get to the quick.
So helping us to really identify, okay, so what are the actual pieces of this job description that are important and that are relevant skills, and whittle that down so that we can quickly match candidates. And the system can do that for us. The system can say, here are candidates that match based on what I'm seeing, thumbs up, thumbs down. And that idea of, again, just being able to take a quick look and say like, yes, that's what I'm looking for. That's the type of candidate that I need. Or like, no, that's not quite right. Let's figure out what's missing here. So yeah, to be able to get that short list of candidates quickly has been really crucial for us for some critical roles as well.
Without a doubt. And just thinking through, you know, CHOP and keeping people coming in. You mentioned earlier events, very quietly. Tell us all about events, because, you know, one of the major pain points that I've been hearing within the healthcare industry has been early talent.
Yes.
How do you tap into those folks who are starting their college careers, maybe taking that turn to graduation? How do you get in front of them? And again, to your point, telling them why they should come to Philly, why they should come to CHOP.
Yeah, so events has been a pretty large part of our overall strategy for the past, I'd say like 2 years now. And being able to kind of set up an event that will display on our career site, even if it's not our event that we're running. So we're going to, you know, a particular school's nursing career fair or something like that. But being able to have that out there on the career site that, hey, we're going to this, and then collect whoever we might meet at it. We've been setting up QR codes to be able for folks to sign up and join our talent community off of the event. So then we can very easily, we've actually set up automations to then, after the events, message out to everyone who attended, with some kind of follow-up action items. Here's some roles you might be interested in, that sort of thing. And be able to have those folks in our system. I mean, I think back even, as little as 4 years ago, having kind of like an interview event for the King of Prussia Hospital before we opened it. And we kind of underestimated the strength of our brand, which is a great problem to have, but we had 400 people show up, which was not what we expected at all. And this was like, the Delta variant was like starting, and we were like, oh no.
Wait, how many people did you want?
I think that we were planning on like maybe 100.
No way.
And we actually ended up like canceling the in-person, but the word didn't get out to everywhere that it had proliferated. So people showed up, and we had a spreadsheet, and it was so painful. And again, that was one of those things that made us go, oh gosh, this is not sustainable. Like, what solutions are out there that next time this happens, we won't have to have a spreadsheet of names that then we have to like individually follow up on. So having kind of that event registration form, and then it feeds directly into the CRM system has been huge, because now those folks are in there for us to be able to campaign to, for us to be able to pull into different talent pools, and share open opportunities with, which is really what it's all about.
Yeah, it connects back to, well, it's about connecting people, but if you're able to connect your data, you're able to connect to people a lot faster.
Yes, exactly.
So I love getting into some of these specific use cases. Thinking about time and scheduling.
Yes.
Where are you guys starting to explore using AI and automation to help that? Like, I hear folks block out weeks in order just to schedule, and they hunker down in one of these fancy conference rooms, and they start doing like calendar Tetris.
Yes.
Was that you?
So it can be complex, especially we tend to want to involve a lot of folks in our interview processes here, which is lovely, but it can get complex.
Right.
And some things that we've already done are building out like some interview day type of events, which has been hugely successful, especially for some of our more high volume roles. So that's something that we've done for a very long time, but was much more of a manual scheduling piece. And now, again, having kind of the one system for events, we're able to kind of put slots in there for people to sign up and just kind of make that a much more seamless process for the interview scheduling. On the horizon, we're looking to explore how we might be able to do some more automated scheduling when it comes to things like, reading people's calendars. The technology can do that to see when they're free and when they're busy, and have candidates do some self-scheduling in that way. So we haven't quite gotten there like across the board yet, but some of our higher volume areas are using some tools to do that now. And it's certainly something that we want to continue to explore for the future, because yes, it can be a lot of time spent just trying to maneuver all the different moving pieces around.
Yeah, without having tools like FitScore and AI discovery to really be able to narrow down that 400 list based on like, hey, are they close enough to the location? Can they be here every day when I need them? Do they have that right experience bandwidth that we're looking for, and those right skills to get them in the right place? Like a tool like FitScore is able to really allow you to kind of move quick.
Yes.
So you shared so much today just around the different solutions and the different places where it's starting to make an impact, where AI and automation is able to live and to make an impact here at CHOP, to connect people to people. Are you guys seeing any impact?
Yes. So we just over the past year have hired, I think it was 27% of all of our hires came from a sourced lead.
No way.
Which is great.
It's over 25%.
Exactly. That was our goal.
You guys beat it. Right on. That's fantastic.
And as we continue to look at like different ways that we can automate, now there's a lot of different categories within that, right? There's a bunch of different automations that we have set up that played into that. There's the outreach that our sourcing team is doing specifically. There's, again, the beautiful career site that kind of does its own thing, feeding different jobs to candidates and allowing candidates to surface jobs through the chat bot and those sorts of things. But yeah, that overall number I expect to only continue to grow as we find new and different ways to continue the automation, continue utilizing that AI. And candidate experience is always top of mind for us as well. So that's something that we're excited to dive even deeper into and find out more from our candidates. We think that we're doing a pretty great job, but how do they feel?
Right.
And use that to be able to make even more improvements.
Get that
as well.
feedback loop going and really
Exactly.
start to make those adjustments and to improve. Are there any technologies that are on the horizon where you're like, ooh, that looks exciting, or I'd be interested in experimenting with that?
Yeah, absolutely. So when I think about our process end to end, the interview process is one area where honestly we still have a good bit of variability across the board. We have interview guides, but we like manually attach them to our confirmations and things like that. And like, are people using them? Maybe, maybe not. So looking at ways that we can integrate that into the process and really be setting our interviewers up for success as well, because I mean, that's a lot to be asking for time out of your day to have a conversation with someone and, you know, be able to pull from that whether or not they're going to be the next addition to your team. We want to make sure that our interviewers feel like they're supported and have what they need to be able to accomplish that. But then also from the candidate side, having a good experience, a consistent experience, no matter who they're talking to, will be huge. And that ability to really have those things available through the process, right? As a lot of our interviews are happening virtually now.
Right.
Pretty much across the board. Obviously, there are some areas that will bring candidates on site to interview too. But that ability to have those tools available and present for the interview process, maybe even looking at some AI transcription, some of those things.
Yeah.
It's all very exciting, and yeah, we can't wait to dive into some of that.
No, and that's all part of that tool too. And it's really about creating that consistent interview process for you, giving you that support on the front end, connecting intake meetings, streamlining that.
Yes.
Using AI to update those questions, and then getting that live guidance. How good does it feel when you have somebody with you that has your back, that's making sure that you're checking the questions, letting you know if you need to dig a little bit deeper, and those scorecards at the end, just letting you know how to evenly stack rank everybody so everybody's getting that fair shake. That's a killer next step, without a doubt.
Yeah.
So Amy, I got 2 more questions for you, if that's cool.
Absolutely.
All right. Do you have a favorite automation or use of AI that you're currently using right now?
Ooh, that's such a good one. There's so many good ones too. I'm trying to think. I think probably, and this is a little bit newer for us too. We just set up our very first like nurture stream email campaigns. So very exciting.
Yeah.
One of them is for our talent community. And we have that set up so that when someone joins, they'll enter kind of like the nurture stream, and it sends them a cadence of emails over really a course of months. So we're having that like continued engagement with candidates and helping them keep CHOP top of mind without us lifting a single finger, which is amazing and incredible. And I'm so excited to see what the like ROI on that is on the other end. We literally just launched these like over the past couple of weeks.
Can't wait.
And then the second one is for what we call our boomerangs. So we love a CHOP boomerang. That is, as you might imagine, someone who has left CHOP and is now interested in returning. And so we get a list from our core system of folks that have left within, a certain number of months. We are currently adding that manually, but hopefully in the future we'll have some AI and automation help there too, into the candidate engagement system. And then once they're added to our boomerang tag in the CRM, then they enter that stream. And again, they're getting things that are geared specifically towards that former employee who's interested in coming back. some, CHOP news kind of things of what's new, what's going on, some information about like, hey, did you know your benefits can be bridged if you're within this certain time frame?
So making those practical connections as well that really connect back to adding that value. To
and
make
of course,
easy.
Calls to action throughout all of it to get them on that career site and looking at open opportunities.
That's fantastic. Last question. If you were to say one thing to somebody who might be listening today and they're still sitting on the sidelines, they're saying, no way with AI and automation, I don't want to mess with it. What would you say to them?
Yeah, I mean, you're going to have to, honestly. You either will need to start to dip a toe into this world, or you'll find that you've been left behind. There are certainly, things about it that can be scary, but where we've found particular success is keeping that human connection and keeping the human in the loop, of course. But what are the things that we can automate and we can bring AI into the mix that are a value add for us? And there have been things that, if we've tried out some different search techniques and things like that, and we're like, this is making things more difficult.
Right.
This isn't helpful. So experiment, that's the biggest thing, and know that it's not going to be perfect immediately. And that's part of it. You have to be able to test. We do a lot of pilots where maybe we look at one particular segment of the organization or one particular type of candidate and say, let's try this out with just this group and see what happens. And more often than not, we say, this was great, let's expand it. But that gives kind of a little bit of a testing ground that feels a little bit less risky in some ways.
Definitely. Thank you so much for your time today, Amy. This was fantastic.
Absolutely.
I hope we could do it again, maybe hear a little bit about where CHOP is going next. Thank you.
My pleasure. Thank you.
Hello, Ivette. It's great to be here with you today.
Hi, Maddie. Great to be here with you.
Great. Well, for those who don't know me, my name is Maddie Hendricks. I am a customer value manager at Phenom. I support a lot of our healthcare customers, and I've been working with Ivette and the Baylor Scott and White team for about 2 or more years at this point. So we have obviously worked together for a while, but for the audience, can you share who you are, a little bit more about Baylor Scott and White and your role?
Sure. Again, great to be here and represent Industry Week for the Healthcare Week. So my name is Ivette Hansen. I lead belonging and talent attraction at Baylor Scott and White Health, the largest not-for-profit healthcare system in the state of Texas. I have been with this organization for just about 3.5 years now. And one of the things that I lead in the scope of what I'm doing is the partnership we have with Phenom. So all things related to candidate attraction, engagement, and journey.
Awesome. Well, last year at Industry Week, you shared your story about high volume hiring, or as you call it, FastTrack, your FastTrack pilot. So refresh our memories on what that pilot was all about, what you accomplished, and how it set the stage for your next phase of innovation.
Yeah, I was so excited when it was introduced to me by our account manager, Ryan. And he had shared that this is a really cool tool that helps us fast track applicants. It didn't have to be just high volume candidates. It could be skilled candidates, but where we see a little bit more volume of applicants than we do for some other positions. So we thought, let's test this out in one of our spaces. So we connected with our HR team and some other folks and said, we identified a specific group of folks where we could do this. And even then we said, okay, but let's start with one smaller location. So we started with a small location, one small job family. And even then we carved out certain positions within that job family that we could ask standard questions of. And we said, we want to fast track these folks. Basically, we want to give them an opportunity to fill out kind of like a short form application that asked a couple of questions, probably somewhere between 7 to 12 questions that helped identify whether we thought they were strong candidates. And if they answered all of those questions favorably, we were able to allow them to self-schedule with the interview. So we were basically bypassing the recruiter phone screen, giving our recruiters time back on their calendars, because everyone knows in healthcare, there are certain positions where you do have a decent volume of applicants, but so many more where you don't. And so we really wanted to give recruiters the opportunity to spend a lot more time focusing on the positions that don't have that high volume of applicants, where they do need to go network and source those candidates. And so we found this as that opportunity. So we applied this fast track process for these groups, and it was way more successful than we anticipated. I know that last year I talked a little bit about it, and we were in the thick of it all. And now we were able to roll this out across that same job group, but all locations across the system. And now we're exploring how to do that even further with other job families. And just to remind everyone kind of what our success looked like, we went from, it took us about 30 days to fill these positions to, on average, it's now about 23. And on average, between reviewing the application, screening the applicant, or scheduling the applicant for a screening the applicant, scheduling them for a hiring manager interview, it was about 20 minutes that it was taking a recruiter to spend with each candidate throughout that entire journey. And we're down now to 8 minutes because now they're just at the tail end of that process. And originally we were looking at 7 candidates to get to 1 hire, and now we're 3 to 1. So it really truly was a successful event for us. Mm-hmm. And we're so proud of that because it took a lot of work to get us there, both from our partner and from our recruitment team and the hiring leaders, and getting them to buy in and really support the experience. So we were really pleased with the outcome.
Yeah, there's great metrics to share as well. How do you think the success of that pilot changed Baylor's appetite for trying new things and new AI technologies?
Yeah, I think it really allowed us to think that AI is not just a theoretical process or a theoretical opportunity, but a practical one that we could apply. And and obviously data tells the story, right? Allowed us to take this data beyond just me and the vendor partner, or me and TA, like beyond that. We were able to relay this to HR, our executive leadership team, and it really allowed them to understand that AI can augment things. But I think one of the other things that we thought we were really impressed by was it took fear out of the scope of things, because it didn't take anyone's job away. It really just opened up our opportunity to do more, because as everyone knows, you're always being asked to do more with less, right? It's not like they give you more labor, more manpower. They just add on more responsibilities and hope that you can accomplish that. And so we were able to show, like, we can do that if we invest in this kind of technology to be able to do that.
Well, your journey with both AI and automation is still evolving today, even with FastTrack. We were on a call earlier today about how you're going to be expanding FastTrack to other roles in other areas of the business. But today in Industry Week of 2025, we are going to talk about an entirely different pilot that Baylor Scott & White is now doing, and that's our voice agent. This is a pilot that you're doing with the graduate nurse cohort. I heard that you literally broke the technology on day 1. And so take us through what happened and the first wave of your pilot.
Yeah, thank you so much. It was so exciting to work on that pilot. So exciting and yet so frustrating at some points. But I have to send a big old shout out to our TA leader, Christine, who spearheaded that for us. So we did pilot something called Voice Agent. For those that don't know what Voice Agent is, it's an agent that will actually screen the applicants in place of your recruiter. Mm-hmm. So when we had the opportunity, when it was presented to us as an opportunity to beta test, we thought, where better to test it than our GN cohort, because we get, on the smallest side, we get about 1,500 applicants. On the larger side, we get as many as 3,000 applicants. And that's within a 2-week window. Just think about all those applicants. And we only have 8 recruiters to do all of those phone screens. So we enlisted our TA leader, Christine, to support us for this. And she tested the product herself. She sat through the demos. She was like, all right, let's get it done. So we sat with the product owner of the tool and said, okay, here's what we want to do. He walked us through everything. We kind of warned him we'd see a lot of applicants on day 1. I don't know if we ever said we'd see as many as 500, but I'm fairly certain we said we see hundreds of them. And I just don't think he believed us, to be quite honest. So day 1 comes of the product, the pilot, we turn it on, and we get hundreds of applicants on day 1. And it broke the system. Nobody expected this to happen. Christine is trying to field everything, intervene where she can. We're escalating this to the vendor, saying, hey, like, you need to help us. Something's not working. We didn't know what it was. We just knew it wasn't working. He ends up coming back to us and saying, we asked, you guys broke it because we didn't expect this many applicants. We never expected this many applicants to apply on a single day, let alone a matter of hours. And so it was really cool to hear that, but at the same time, infuriating, thinking like, what did you mean? Like, so day one, we have this complete meltdown of everything. We break the system. Day two is completely fixed, but we're still dealing with day one, right? We're still dealing with all of that. And Christine could have said, forget it, we're scrapping this whole thing. We're actually going to move on. And now we're going to go to the traditional process, which is the recruiters screen the applicants. And we would typically bring in a team of administrative support team members to help screen all those applicants. So we're talking 8 plus anywhere from 3 to 5 additional administrative team members to help screen all these applicants, to get through those screens as quickly as possible. But she didn't say that. She's like, I'm going to hold firm. I'm going to keep trugging along. And so we were meeting with the product owner twice a week to make sure that the solution was did go off well. So by day 2, he fixed it. By day 3, everything was going seamlessly with regard to the candidate experience. There were still some things on our end from the recruiter experience that we needed to be addressed. That there was lagging in the CRM time. There was some systems, when it said system complete, it wasn't really complete. So there were some things that we still needed to give him feedback on. But the cool thing is we were giving that feedback in real time. And the product team was actually working on it in real time and would email with us within hours and say, like, this was fixed. Can you test it? This was fixed. Can you ask the candidate to try again? Like, it was really cool. So ultimately, we had 1,800 invitations, or nearly 1,800 invitations sent, and 85% of those folks completed the screen with the voice agent. It was phenomenal. And then, you still wonder, though, is Christine sold on this? Is she not sold on this? Is her leader sold on this? Is she not sold on it? I don't know, because her leader came to me and said, I have real concerns. It's been quite messy. And I said, I agree. There was a lot of things going on. I still have hope for this technology. The coolest part was Christine came to me after it was all said and done. We gave feedback to the product owner. It ends up to be a wonderful product. They've made 6 or 7 more enhancements to the candidate experience and the recruiter experience. But Christine came to me after it was all said and done and said, any chance we'll have this for the September cohort? Which you think, oh no, like, are you serious? Like, she loves it that much. Her leader then and I are talking about FastTrack, last year's initiative that we piloted and went live with. The leader and I are talking, and voice agent comes up in conversation. She's like, hey, any money we can bundle voice agent with FastTrack in the process for candidates? I was like, so we turned 2 folks who were nervous about it, who weren't sure this technology was going to work, into believers. So, and they're both in leadership roles who then obviously sell their teams on this. So, and our hiring managers. So it wound up to be a really fantastic experience. One that we're actually we're going to consider piloting a second time with a smaller group of applicants.
Innovative thinking going on here. An 85% conversion rate is just awesome and fantastic. Was there anything else surprising about some of the reactions of even the other team members who were working on this?
Yeah. So when you hear we're going to apply an agent to screen your applicants for you, you think a recruiter is going to start to get nervous. They're going to be like, oh, geez, what's going to happen to my job? These recruiters embraced it. They actually gave us feedback on how to make it better with regard to what they see in the CRM. When they see the applicants coming through and they see their information, they want to be able to sort it a specific way without having to do 3 additional touch or clicks. If it looked like this, it would be so fantastic. So they were giving us feedback to enhance the experience from a recruiter perspective. And then to find out, they too are hoping that in the next cohort, we can apply this technology. So it's just so fantastic. Like, you never think you're going to hear that from a recruiter because there's this fear. But I think that's one of the wonderful parts about having transparency and sharing with them why technology is important and how it's really just going to augment your work instead of take over your work.
Yep. Keeping that human in the loop for sure.
Yeah.
Now, I know Baylor Scott and White is always one to raise their hands to be a beta tester. I know this. How do you approach being a beta tester for cutting edge AI technology in healthcare, and what is your philosophy?
So I love testing all products, right? I love testing them for a number of different reasons, because you want to stay ahead of the curve, but you also want to know, like, what are candidates expecting of us? Especially in healthcare, candidates want to see us respect their time and respect the fact that they're likely getting multiple offers from other healthcare providers. And so we need to honor that respect and say, here's how we're going to serve you to ensure you're getting what you need from us in the timely manner. So I think that that's one of the reasons we look at beta testing products that are going to help us with the candidate experience. Ultimately, we look at what will enhance the candidate experience, what will enhance the recruiter experience, and what will enhance the hiring leader experience. If we have products that do any of those three things, hopefully all three things in one product, then we absolutely look for it. I socialize this with my peers who spearhead the recruiting efforts because, again, transparency and buy-in is really important. So I always give them a list of the things that were offered to beta test and say, here's what this tool will do, here's what this product will do. Is there any interest? And if so, let's start the conversation. And then you invite them to the table with the vendor or the product owner and make sure they understand what's happening. And maybe my peer isn't the person on there. Maybe it's one of the recruiters or maybe a manager, and having them on the call to understand what the tool does, to understand what the product or the workflow is going to look like, so that you can get that buy-in and that kind of transparency and say to them, here's what we're doing. And then they can actually socialize that with their teams as well.
Right. Yeah, that makes sense. What lessons did you learn from the voice agent experience specifically that you've applied to other AI implementations or ones that you plan to do?
I think what we learned was don't take anything for granted. The first thing is, we used to go into this thinking it's fully built and we're just testing it out. Well, that's not true. It's not fully built. That's why we're testing it. We're testing it to see what we could break. So I think that was one of the things we learned. I think another thing we learned was complete collaboration with the vendor partner is really important. Making sure we have those weekly touch points, sometimes even twice a week touch points, to say once at the beginning of the week, once towards the end of the week, to say, here's what we saw happen over the weekend. And then here's what we saw happen through the weekdays, and giving them that feedback in as real time as we could get it to them. Obviously practicing grace where we need to practice grace for them and for us, right? If we miss something, let us know we missed something. If they oversold something, share that feedback, but give them grace, right? And say, like, maybe you expected it to operate this way, but that's not what we're seeing. And then communication, making sure that we're constantly communicating with one another. I think one of the things from our perspective is, we have a programs team that helps us manage all of this and making sure that they're always communicating with the TA team who's actually experiencing this on, here's what's happening, here's what to expect, here's the workflow, here's the process, here's the discovery workbook, all of those things to make sure that they feel like they're in the know, not only in the know, I guess, but actually a part of the process. And then again, bringing them in to speak with the product owner so that they can hear it directly from them as to what's happening. I think those are some of the things we learned. And then I guess probably the most important part is when we first introduced this to our TA leader, Christine, we introduced it as theoretical, not as practical. Like, here's what we plan to do. It was more like, if we had a tool that could do this, would you be interested in piloting? She was like, of course I would, because who wouldn't say yes to, in theory, we would want to do this. And then we kind of said, oh, here you go. You said you would. And she was like, wait a minute. So then we demoed it for her so she could see the whole thing from beginning to end. Now, here's what the recruiter is going to experience. Here's what the candidate is going to experience. And then it allowed her to really understand it. And then to say, okay, now that I've seen it, here's what I need it to do. And let her weigh in on the process and the workflow as well. So I think those were some of the biggest learning lessons from the voice agent experience.
Yeah, definitely. That's awesome. And you've mentioned, right, beta test so much, both the FastTrack, the voice agent, and everything in between. And I think you're looking at a couple of different agents like Interview Intelligence. What's your current AI tech and agent portfolio looking like?
So it's interesting. We have so much automation. I just actually had to spell this out for some of our leadership teams. So so we look at the employee journey holistically, and in the employee journey for us actually starts at our traction and ends at alumni. So we look at the journey and we say, where could we automate, or where do we have automation already built in, and where do we need it? And again, we're always thinking about the moments that matter for a team member. So if you think about the team member journey from an attraction perspective, it's really about the application process. Have we automated that? Do we have a chatbot to be able to answer their questions 24/7? And we do. We have those things in place. If somebody abandons their application, we have automation set up to remind them, but also remind a recruiter. Like, hey, you've got 3 people who didn't complete the application for this requisition. Do you want to send them out reminders or reach out to them directly? Because here's the information we've been able to collect. So it's things like that we look at when we look at the onboarding process. We have a relocation program that has automation in there. Once they're in-house, internal mobility, we have an employee referral program that offers automation and real-time status checking on their referrals. So there's all these different opportunities that we've been able to automate and really provide the team member from attraction to alumni, seamless experiences that are quick, that are in real time. Some of them are AI. Some of them are just automations that are built within our technology. And then there's still opportunity for agents. Like, we're waiting for the agent for talent marketing to come out, which I think is going to come out next month. Really excited about beta testing that. Voice agent is one that we're beta testing now. There's a few others that have been presented to us that we thought originally we're like, we don't know if we need that. And then you think about it more and you're like, we probably do need that. Yeah, we probably do need that. And there is opportunity to beta test that. One of them is tied to interview intelligence. We're going to have an opportunity to test the agent on an intake call. So, your recruiter sits with your hiring leader for that intake call to collect all the information about what are you looking for in a successful candidate. And now we can assign an agent to that conversation. So that, again, giving the recruiter time back to source candidates, to do networking, to manage their hiring leaders on positions they already have open, maybe do some rounding at a hospital because that takes up a lot of time. Maybe there are certain positions that require a little bit more white glove treatment of the candidates that gives them the opportunity to go back and do those things.
Yeah, that makes sense. And you touched on this a little bit when talking about your process and the key touch points for a candidate, but there's so much coming out right now. How do you decide which AI agents or any tech, to test and which roles that they're best suited for?
Yeah, I think we look back at the team member journey and the moments that matter. Is it going to affect our moments that matter? Ultimately, you're right. There's so much technology out there. To pick something just to pick it doesn't make the most sense. That's why when we get an offer to do an agent beta test or a beta tested product, we look at the moments that matter. Will it affect our moments that matter? When they're an internal employee, we look at 30, 60, 90-day check-ins. We look at their career progression. We look at things like that. Those are the things that matter when they have senior leadership changes. Now, is there any technology that helps us address those moments that matter? And if so, those are the things we select to beta test. I will say sometimes we're asked to beta test things that don't address our team members' moments that matter. And we do it to support our vendor partner, to say, like, if there's anything we can do to help support you the way that you help support us, we're gonna do that. So there are a few opportunities that we've been given that way as well. But for the most part, it's really about what is going to help support our moments that matter.
And well, I can say that we definitely appreciate your feedback. So just looking a little broader and looking ahead a bit, how do you see that the AI agents are transforming both the candidate and employee experience in healthcare?
I think it's going to give us time back a lot. That's the first thing you think about. I think it's going to affect our time to hire, our time to source, even for those hard to fill positions. I think it's going to streamline existing processes. I think candidates are ready for it, for agents to be involved in the process. We've seen it, obviously, with the GN cohort that we just did with Voice Agent. I think hiring leaders are a little bit more skeptical about it, but I think they're getting more familiar with it as we roll things out to them. So I think it's going to change everything about how we do, from a nice to have, but it's a must have, right? Candidates are expecting us to apply technology, automation, and AI where we can. And if we're not doing it, then we are actually slowing the process down. And that's not what candidates are expecting of us. They expect, as time goes on, that we will evolve, and we need to evolve, and AI is going to help us do that.
Yeah. Well, what a great journey that you've had, and success and learning experience with the voice agent. Let's talk a little bit more directly to the folks that are listening today. what advice would you give to healthcare organizations that might be a little bit more hesitant about beta testing and new AI technologies?
I want them to stay hesitant because then we get to keep it all. No, I don't want that. No, I don't want that. I love sharing this information. I've talked to so many people within other healthcare organizations and academic organizations who are looking to do this very thing. And I would say to them, don't don't let fear stop you, or and don't be afraid to educate others. Like if it's not your own personal fear or trepidation that's saying, I don't want to do this, if it's that of others, educate them, share with them, have your vendor partner next to you and saying, here's what we can do for you. Here's and talk to other people who've already done it and say, like, what was your learning lesson? Why did you do it? What was the outcome? And then take that information back to your leadership team and say, here's what we have the opportunity to be a part of. Here's where some other organizations have done it. And the cool thing is you get to be on the shoulders of those other organizations. So I actually talked to somebody, we're looking at an events platform, right? And I talked to another healthcare company, or it wasn't a healthcare company, another company who does high volume hiring, and they use the events platform pretty regularly. So I reached out to that person and asked 1,000,001 different questions about how they're using the platform, what they love about it, what don't they love about it, what's still being developed from it. And so that way I feel educated and I can go back to my team and say, if we're looking at this events platform, here's how it would work for us. Here are the pluses and the minuses. And everyone feels well informed. No one's going to be caught off guard when something doesn't go as planned. And then remember, you're beta testing. So you're basically testing a product that is not off the shelf ready to be used, but they're looking for input to make it the best and optimal product it can be. So that's always my issue. Like I always think, well, shouldn't it work this way? Well, maybe eventually it will, but they need your feedback to get it there.
Definitely. And for healthcare organizations that want to follow your path in both automation and AI agents, what is your roadmap advice?
I think be collaborative, bring in other teams, because when you don't, that'll stop you, right? So make sure that your tech team is there, your legal and compliance team is there. Anybody who is a stakeholder in the process is next to you. Just because if you don't, you end up having to backtrack and it doesn't work for you. So our roadmap is pretty transparent. Like we do fiscal year priorities every year, and we write out, and I'm actually in the midst of doing it now. So you write out what the strategy is, what you hope to accomplish with it, like the definition of it. Then you do an outcomes, and then who are all the stakeholders involved that you need to make sure are there. And you share that transparently with your executive leadership team so that you get that buy-in. So our roadmap is pretty clean right now. There are certain things we're looking for. Voice agent is one of those things we're going to continue to pilot. We have an opportunity to pilot it a second time with a different group, which is not going to be as high volume as our Jan cohort. But we're also looking at the events. We're looking at social sharing. We're looking at, automating some other processes that we have in place with regard to onboarding and relocation and things like that. So we offer all of that in advance to our executive leadership team.
Yeah, that's great. Well, I think that's it for us. Thank you again, Ivette, for being here and for sharing all the innovative things that your organization has done and continues to do. It is always a pleasure to chat, and I hope you enjoy the rest of Industry Week.
Thanks so much, Maddie. It's been a pleasure sharing this information with you guys. I hope everyone gets at least a little nugget that they can take away from it. And if you have something to share, reach out to me. I'd love to learn what everyone else is doing. It's been a pleasure.
In healthcare, speed and precision in hiring aren't just business metrics. They're critical to patient care and safety. Today, we'll walk through how Phenom Hiring Intelligence transforms the way healthcare systems, especially those hiring for nursing roles, identify, engage, and hire top talent using automation, intelligence, and real-time insights. We'll follow the journey of a nurse candidate and a recruiter, showing how automation helps fill essential roles faster without sacrificing quality or compliance. Candidates are not behind computers in these cases. They're often bedside, working odd hours, and expect a seamless, mobile-friendly process. Let's imagine a nurse browsing open roles between shifts. She lands on this job. Notice how simple and clean the experience is, from job title to responsibilities. With Phenom Careers sites, we automatically personalize job recommendations based on the candidate's previous searches and behaviors, even certifications. Candidate-focused, mobile-optimized, and deeply tailored to high-intent job seekers. So I'll click Apply, and here, Phenom's hiring assistant appears. This is where things get intelligent. Instead of filling out a long application, the nurse can verify licensing, certifications, shift availability, and answer pre-screening questions in seconds. Behind the scenes, Phenom is using X+ screening to evaluate the nurse's qualifications and determine fit. This is ideal for healthcare roles where hiring decisions hinge on very clear binary criteria: RN licenses, BLS certification, years of experience, and so on. Depending on how the candidate responds to the questions here, they can either be scheduled for an interview right away and fast-tracked so that they're in front of your hiring team immediately or as soon as possible. Or if they need additional questions asked of them, if they need further evaluation, that's where you can do X+ screening. And X+ screening allows your recruiters and your hiring team to view the results in your own time, saving days of time on your calendars. Now, if a nurse has time and is able to stop and look at a computer, they can also look at these roles over a web experience. And this really lends itself to that omni-channel experience that is critical in hiring today, especially in healthcare. Now, based on the information provided, a candidate can enter their information through the quick apply forms, get the same kind of information you just saw in a bot experience, but in a really clear web form. Here you're asking just the most critical questions that you'll need to help sort and organize your talent into highly qualified, meets requirements, or doesn't meet requirements at all. They get the opportunity to review their information. And here you can also personalize the experience. Maybe you really need candidates to complete an application, a formal application. Maybe you need to have them screened. In this case, they can use one of the voice agents that we have been talking about already, or they can schedule an interview with a member of your team in a time that's best for them. And just like you make doctor's appointments yourself, everyone wants to self-schedule. So in this case, it's really easy for them to self-schedule a date and a time that works best for them. Behind the scenes, the calendar assistant is checking availability for everyone that's required on the hiring team for this particular role and this particular interview. And all of this can be templatized. And the candidate has now provided a screening that can be evaluated by a hiring manager or the recruiting team in their own time as well. Now let's shift to the recruiter's view. With Phenom's automation engine, recruiters are no longer stuck manually sifting through hundreds of applications. Instead, we can build automations like auto screening for licensed RNs with required credentials, auto status updates to candidates so they're never left in the dark, auto scheduling interviews based on hiring manager availability. And these automations can run 24/7, which is critical for hospital systems that are also running 24/7. Think of this like a GPS for your hiring process. You're not locked into one rigid path. Hiring intelligence lets you calibrate mid-journey, shift tactics, and continually optimize. Let's say you're not seeing enough qualified ICU nurses in the pipeline. With hiring intelligence, you can adjust screening thresholds, expand to similar roles, or even trigger campaigns via Talent CRM to re-engage past applicants. Speed to hire is critical, but so is compliance. With Phenom, your automated hiring workflows are still auditable and compliant. Every decision made by a bot is logged, traceable, and configurable. You stay in control. And of course, everything rolls up into Phenom Analytics, so TA leaders can see time to fill nursing roles, where candidates might be dropping off, which sources bring the most qualified RNs, and how automation is impacting hiring KPIs. We started with our nursing candidate, getting them in the door quickly through personalized experiences and intelligent chat. Then we showed how automation simplifies screening, scheduling, and engagement for your recruiters. Finally, we looked at how hiring intelligence lets you pivot, adapt, and continuously improve your hiring workflows. Phenom's hiring intelligence helps healthcare organizations do more than just fill roles. It helps them staff smarter, faster, and with greater precision, so care teams can keep doing what matters most, caring for patients.
In healthcare, hiring isn't optional. It's mission critical. Every open role affects care delivery. But when it comes to high volume clinical roles like CNAs, transporters, lab techs, medical assistants, recruiters are already stretched thin managing multiple job recs and urgent hiring needs, while their hiring managers are juggling shift gaps and last minute callouts. There is no time for days long back and forths just to ask questions like, are you certified? Can you work weekends? When are you available to start? And at the same time, candidates, they expect instant communication, whether they apply at 10 a.m. or 10 p.m. And if they don't get it, they move on. That's why screening needs to be fast, flexible, and human without adding to recruiter workload. And that's exactly what Phenom's voice AI agent delivers. So before we jump into the call itself, let's see what this voice agent will cover. So these aren't just random questions. They are fully tailored to your role, your compliance needs, and your brand voice. So for this emergency RN role, here's what we're asking. We're asking a knockout question. Do you currently hold an active registered nurse license in Pennsylvania? Can you thrive in a fast-paced environment with rotating shifts? We have some open-ended questions. Imagine you are in the ER and suddenly there is a surge of incoming patients. Explain how you would prioritize their care. Have you ever faced a situation similar to that in real life? If so, how did you handle it? And staying updated is so important in healthcare. How do you keep up with evidence-based nursing practices? And I'm able to add questions or even use AI to generate those questions. This ensures a consistent, high-quality screening every single time, no matter when the call happens or who's applying. So let's see this experience from the candidate's perspective. So some things that you're going to notice before I take this call is that this agent is going to understand natural speech, not just yes or no. It will handle interruptions and clarifying questions. It's going to give relevant answers based on your company's context. And once qualified, it will offer to schedule an interview on the spot. There's no awkward looping, there's no waiting for a callback, and there's definitely no press 1 for type of nonsense. It's just a natural conversation available 24/7. So let's listen.
Hi, this is Ava, a virtual agent calling on behalf of Community Health Systems. May I know who am I talking?
Sure, this is Jen.
Hi, Jen. I hope you're having a great day. Thank you for your interest in the registered nurse position at Summit Care Medical Center. I'd love to ask you some quick questions to see if this opportunity aligns with your career goals. Do you have a couple of minutes to chat?
I do, yes.
Great. Let's start with a couple of important questions. Do you currently hold an active registered nurse RN license in Pennsylvania?
I do, yes.
Thank you, Jen. Can you thrive in a fast-paced environment with rotating shifts?
Yes, absolutely.
Now, let's dive into a real-world scenario. Imagine you're in the ER, and suddenly there's a surge of incoming patients. Walk me through how you prioritize their care.
Oh, yeah, that's a great question, and one that I've come across many times. I always prioritize patient care based on the severity of their illness or injury when they come into the emergency room.
That's a great approach. Have you ever faced a situation like this in real life?
Oh,
So, how did you handle it?
yeah, multiple times. I handle it just like I just said, always prioritizing the most critical first.
Thank you for sharing that, Jen. One more thing. Staying updated is so important in healthcare. How do you keep up with evidence-based nursing practices?
Yes, continuous learning, trainings. I'm always looking for opportunities to learn more and make sure I'm staying up to date.
Thank you for your responses, Jen. Before we move forward, do you have any questions for me?
Can you explain about the culture of your organization?
At Summit Care Medical Center, we focus on patient-centered care, excellence and innovation, and community accessibility. We foster a workplace that supports diverse backgrounds, encourages work-life balance and career growth, and invests in sustainable healthcare practices. It's a culture of collaboration and continuous improvement. If you have more specific questions, feel free to reach out to HR@summitcare.com for more details. Thank you so much for chatting with me today, Jen. We'll be in touch soon.
Oh, thank
Have
you.
an amazing day.
And just like that single conversation just replaced the phone tag, the manual note-taking, and scheduling delays that often slow down clinical hiring. Meanwhile, recruiters are not bogged down with repetitive calls. They get a complete screening transcript, candidate scores, and interview bookings without lifting a finger.
Here's the deal. Navigating career growth in healthcare can be challenging. For seasoned clinical staff that are close to patient care, new career paths are typically well understood. But what if an entry-level clinical aide wants to get more into nursing, let's say? What about your early talent who aren't clear on where their career can take them within your organization? How can you ensure that they understand the variety of options that are available and what it will take to reach the next step? And then, of course, there's your non-clinical staff that keeps things running smoothly behind the scenes. A lack of visibility and agency in controlling one's career path is leaving the majority of healthcare professionals feeling stuck and unsure about their next steps, which can ultimately lead to high disengagement and, inevitably, high turnover. Phenom Career Pathing was built to address all of these scenarios. The first step is creating a good baseline understanding of an employee's skills. Remember back when that new employee applied and joined your team? With Phenom, all that data isn't lost. The Phenom Intelligent Talent Experience platform is collecting and aggregating all of this data to be leveraged on an employee's first day. They are ready from the moment they join your healthcare network to see where they fit into your organization today and where they can go next. The Phenom Talent Marketplace is where the employee profile lives. Integrations will bring in data from employee applications, but employees can further refine this information just by uploading their resume to complete the rest, or add it manually. All of the data is important, but skills are the key here. Skills are the primary driver of how Phenom AI delivers personalization and recommendations from within the system. We see here that Amelia already has her profile started. She can continually add to her profile, like skills, topics of interest, and known languages at any point in time. You can scroll down and see where skills rank from beginner to expert. Employees even get visibility into core competencies and steps that can be taken to excel at their current role. Once an employee is interested in taking the next step, they can start exploring the career pathing tool. Phenom's AI will make recommendations based on previous moves, skills, and experience fit, or what the company wants to promote as career paths. At a glance, Amelia can see what roles they are best fit for moving forward. from a nursing assistant to an ICU or ER nurse. Amelia can also get insights into roles that may be a good fit for her that may not have crossed her mind, opening up more opportunities in your organization, like a nursing educator. Employees can dive into each recommended role to understand their current skill gaps and what it will take to reach the next step or even the step after that. But not all career paths are linear. If an employee wants to make a change in their career path in another department, Phenom Career Pathing can help. They can search across the entire organization and see how they fit against roles in other areas, and easily lock in lateral moves as their desired career path. Information like required time in their current role can be surfaced to help them understand not only what skills or competencies they have to acquire, but also what minimum time they must spend in their current role. Once a career path is chosen, Phenom AI starts creating personalized upskilling journeys for your employees, identifying online learning from your LMS that aligns to their skills gaps, connecting them to potential mentors within the organization that can help them progress quickly toward their career goals, and gigs or project work that can provide a hands-on opportunity to learn and apply different skills. As employees participate in upskilling activities, their profiles will automatically be updated so they can track progress on their desired roles. And with Phenom Employee Relationship Management and People Manager, this information is shared with their manager as well as human resources so that they can also see how readily employees are engaging with upskilling and make relevant recommendations based on the chosen career paths. The tool is extremely flexible. Think Simone Biles. Phenom AI will build a baseline of common progressions based on analysis of your organization's data. But you have full control over whether you want to promote these progressions to employees, and you can supplement with defined progressions if there are certain roles you want to build a stronger bench for. Before using Phenom Career Pathing, employees might have felt uncertain about their career progression. Now they have a clear, personalized roadmap that aligns with their goals. This not only boosts employee engagement and satisfaction, but also enhances retention rates and supports strategic workforce planning. Organizations can see a tangible impact on their talent development metrics, leading to a more skilled and motivated workforce. Stay tuned for more as we dive into early talent next. You won't want to miss it.
So here's what we know. In healthcare, you're not just hiring for the roles you need today, you're investing in the clinicians of tomorrow. And right now, those future nurses, future rad techs, therapists, and specialists, they're still in school. They're showing up for their classes, grinding through clinical rotations, learning the ropes in real-world care settings. And they're doing all of this before they've chosen where they want to work. But the competition to win them over, that starts now. You need to make an impression on campus, at career fairs, online, well before their graduation caps go flying in the air and they're flooded with job offers. And the bar, it's high. Early talent expects digital, fast, personalized, and human. Meanwhile, your recruiting team, well, they're balancing 24/7 staffing needs, hard-to-fill clinical roles, and now they're adding early talent outreach to the mix, often tracked in spreadsheets, scattered email threads, and sometimes in a literal bag of resumes with handwritten notes from the last in-person event. It's a lot. And if we're being honest, missing just one follow-up, one connection, one high-potential candidate could mean losing a future hire and having to scramble to fill that same position later, just with more urgency and less time. So the question is, how do you effectively build early talent pipelines without burning out your team, missing high potential candidates, or letting all that effort fall through the cracks? You need a better way to connect, engage, and follow through at scale without losing the human touch, especially when it comes to career events. So let's talk about what this looks like in action. If you've ever hosted a career event to reach the next generation of medical professionals, you know how quickly it can get hectic. You're juggling conversations, collecting resumes, answering questions, scribbling notes, and trying to keep track of who's actually a great fit in a spreadsheet. That student graduating next month with a CT focus and night shift flexibility, that's a unicorn. That is maybe your gold. And without a system in place, trying to find them again in a stack of paper resumes is like mining for that gold with one of those plastic forks. Here's what it looks like when all of that chaos becomes manageable. This is the Step into Imaging Career Day we set up for Rad Tech students and recent grads. It's an in-person event hosted right at the hospital. And the best part, this was all created directly within Phenom. So it's not a separate platform or some random tool you have to log into. This is fully connected to your talent CRM, your career site, and your automations. That means less time chasing information and more time focused on what matters, building relationships with that future clinical talent. This entire event was created in minutes. No IT tickets, no HTML knowledge needed. You just fill out a few key fields. Even better, if you've done a similar event before, you can even duplicate it and make some quick edits. It really is that easy. So with the event description, obviously you can include text, but you can also drop in images or even videos. Think a day in the life video from one of your rad techs, or a quick welcome from your imaging director. It's a great way to make the event feel more personal. Scrolling down to registration. This is the registration form, and it's fully customizable. For this event, it's tailored specifically to rad tech students. So you're collecting the details that actually matter. Graduation date, certification status, modality preference, and shift interest. In other words, you're not just collecting a list of names. You're getting insight into who's ready for work, where they want to go, and how they might fit into your organization. That's huge when the goal is to hire faster and smarter. Once the event's published, this overview page becomes your hub. The pre-event checklist keeps everything on track. Outreach, reminders, follow-ups, no scattered emails, no shared drives, just a clean, centralized plan. You're going to have the ability to take care of so many details right here, things that would have bogged you down before. You can enable a configurable evaluation that you'll use at the event. Preset email reminders that will go out on your preferred cadence. 3 days before the event, consider it done. 1 day before the event, yes. You can send pre-screening questions before the event, inviting candidates to answer simple questions that will give you additional insights. And speaking of insights, you'll see the candidates that are registered for your event, and this will update in real time on the day of. If you're holding interviews at the event, that schedule will be available. Booths and sessions are also managed here. You'll have visibility into the analytics so that your team knows what's working for these events and what's not. And this is what the candidate sees. It's branded, mobile friendly, and built for ease. No login walls or clunky steps, just clear information and a fast registration process. And the moment someone signs up, they're automatically added to your CRM, tagged, tracked, and ready for the next step. In a competitive market where rad techs are the gold, this is how you stop losing them to faster offers and start building your talent pipeline before they even hit the market. All right, let's fast forward to event day. You've got your team on site, students are walking in, and now the goal is to connect quickly and capture the information that matters most without juggling clipboards, chasing down resumes, or wondering who actually showed up. And yes, they're showing up because the automated reminders you set earlier actually work. These are busy students balancing clinicals, coursework, and part-time jobs. So a quick nudge earlier in the week, another one the day before, and the morning of can make a big difference in turnout. And it all happens automatically. Every candidate who registered ahead of time is already in your system. And when they arrive, they check in by scanning the unique QR code they received after registering. That can happen one of two ways. Either your booth staff can scan them in, or you can get a self-service kiosk set up. And if someone shows up who didn't register ahead of time, no problem. You can scan them in manually or have them fill out the same mobile optimized registration form right there at the event. You're still capturing the same key information, you're still bringing them into the CRM, and you're still tagging them for follow-up. As soon as a candidate is checked in, the attendee list, it updates in real time, and your team knows exactly who's in the room, who you've talked to, and who still needs a follow-up. No guessing, no clipboards, no post-event scrambling. And here's where healthcare teams really benefit. You can quickly connect potential candidates to your clinical staff without needing to give them additional CRM licenses. Your lead rad tech, imaging manager, or even current team members can use the Phenom event apps to add notes, flag strong candidates, or tag modality interests right from their phone. Because sometimes the best hiring insight doesn't come from a resume. It comes from human experiences and connection. With Phenom, that context, it doesn't get lost. It gets captured. Booth staff or recruiters can tag CT interest, note graduation dates, or even evaluate candidates right on the spot. Everything syncs automatically. So now your team walks away with more than just a list of names. You leave with a pipeline of skilled, qualified, and engaged students ready to step into critical roles across your organization. And what we've shown you today, that's just the start. This is one type of event, an in-person early talent healthcare fair. But the same Phenom platform can support anything you can imagine. Virtual information sessions, campus recruiting roadshows, on-site interview days, even large-scale system-wide hiring events. And because it all lives within Phenom, your talent CRM, your career site, your automations, every candidate, every interaction, every follow-up is connected. You're not just hosting events. You're building long-term talent pipelines that support your workforce today and tomorrow. And when that's done right, the impact is immediate.